Good day. Hope I find you well. Today I'm going to present about fetal medicine routine. Um, that's how they operate. What's their day like in that department? What are you expecting as a patient, as a client, when you visit fetal medicine? And when you're seated on the bench, what are your expectations? I'm just trying to give you a preview of what you'd be thinking of or imagining is happening in that department before they say come in, and what you'd also expect when they say enter, and what to expect when they assess you. So it's kind of a routine, or that's their daily today service. However, we got some unfortunate or some urgent emergencies, which I might not really talk about today. I might just give a hint, but I'll definitely have a day when I'll talk about that. So on a daily basis, fetal medicine is a time conscious department. They book their patients, and as a patient you need to stick to your time. You need to be time conscious. We need to move from that primitive behavior or primitive way of doing things, whereby you think if you're given an appointment for 10 o'clock, 10:15 will be okay, half past the 10 will be okay. No, it doesn't work like that. When you get time to say you are seeing the doctor or the midwife or the specialist at 10 o'clock. Let's stick to time. This is both to private and to the government sector, but allow me to talk about the private sector on its own on some days, on how fetal medicine is kind of run there. This is just an insight or an awareness to say these things happen, I've seen them happening, and these things happen like this. All right. But let me come back to the government sector. A midwife or midwives are running the department most of the time. They also escalate to the doctors after that, and who then also escalate to the fetal medicine specialist if there are some challenges. There are also some sonographers in fetal medicine, right? Yes. So let me say we need to be time conscious. Zimbabweans, we need to be time consciousness, and that's convenience or that inconvenience which is caused by not sticking to time. It's really a lot. 15 minutes, it's really a waste of time if you're not sticking to time, right? Yes. And then so the midwives work with a list. They book their patients according to conditions. They book their patients according to the clinic of that day. What clinic are they having? Is it twin pregnancy? Is it just multiple pregnancy? Is it growth scan clinic? Is it fetal echocardiograph? Is it first trimester clinic? They've got different clinics which I'll just peruse, but I want to say, let's move away from that mentality of saying if you are given an appointment on Monday, you think Tuesday is okay. And then when you're given an appointment on Tuesday, you think, let me just do this. This is very crucial to me. And then I'll attend to this appointment on Friday. No, a Monday is a Monday. It has got its own clinics. It has got its own problems to be solved, and it's a Monday for those conditions. You understand? Yes. Don't create your own time. Don't create your own service. Stick to what the midwives and the referral centers would have said to you, right? And then it also comes to a point, what I can add on to that is when the fetal medicine department says your condition is an emergency, and you just think, but if I go home today and come back tomorrow, I think it will be fine. Or when they say you need to deliver this baby today, and you think, but give me 3 days or 5 days. No, it doesn't work like that. Okay, coming back to routine. I come back to say, okay, you are booked by time. You stay on a bench and you're called. You enter the room. Obviously, the midwives would greet you. They would ask for what we term informed consent. They perform their scan according to what we have consented to, right? Because we've got different scans as well. We've got transvaginal, transabdominal, in which we say, oh, we need you to give consent or to consent to those scans, all right? It's just a hint. I'll come back again, give you some more information about all those things. Then after the assessment, the fetal medicine midwife would give you counseling according to results or to what they've seen or to what they, or even if it means they need to escalate the care to the next point of care, all right, or to the fetal medicine specialist. They would let you know, and then from there you are given your management, or they talk to you about your management. Do you need subsequent visits? What is going on? Emergency, urgency? Does this baby need to be delivered like now? Or are they changing your management according to what they've seen? It's a whole lot of things which I'll then talk about again, right? After that, you get a report, a well-detailed report, which has been explained to you, which you understand, you and your husband, right? You and your relative, you and your partner, you and your significant others, or you as just you. All right? Yes. That report, you also have a review date, the date which you're supposed to be coming back. Let's stick to our review dates. I think of crucial again about the whole routine is that the fetal medicine, if there's some emergencies, they communicate to you. They'll definitely call you. They'll definitely disseminate information, and you might be called to come back or to just let you know, to just update you, to give you some feedback. All right. Yes. So all this happens in fetal medicine in a government sector. I'm talking of Parenyatwa, I'm talking of Salim Mugabe, and I'm also talking of other referral centers and other hospitals and clinics which we trained. This is what we told them. We told them to write reports, we told them how to scan, and we told them how to disseminate information to the patient. Okay, Zimbabwe, I'm talking to you. Today's women, and I'm talking to you, today's husbands and partners, and those who are just in pre-marriage status. Is this not worth embracing? Is there any point of going back to just a Doppler, which doesn't show you the sex of the baby, which doesn't show you the fetal defects of the baby, which do not even show you if the baby has got any problems, any illnesses, or anything which needs to be dealt with as urgent as possible? I think we need to embrace the new. I think this is now the way of managing your pregnancies. We are saying we have this in government sector, and we also have this in the private sector, and people used to travel long distances or across the border, crossing the borders and coming to well-developed countries searching for fetal medicine, and we are saying it's now home. It has been brought home. It's now just on our table. I think it's worth embracing the new. I think it's just worth to embrace modern way of obstetric management. Doctors, gynecologists, obstetricians, I'm talking to you, and I know you know it already through this song, but we are saying let's spread the news. that we now have new management, modern way of managing.